Hey guys, it's Kyla at the MJC, and I'm here today to walk you guys through the medical and healthcare expenses section of the marital settlement. And you'll notice the form I'm in is the proposed marital settlement, but this section is the same for both the marital settlement and the proposed marital settlement. So if you are folks who are filling out the MSA, do not worry. Even though we use the same video for both, the sections are the same. So don't need to worry that technically I'm in the different form. But before I get going, as always, just a reminder that nothing in this video is intended to be legal advice. It's a video, so I can't analyze your specific situation, and I'm not able to make sure that the forms that you're filling out are the right ones for your situation, that a court can approve what you're agreeing to or proposing, or that what you're agreeing to or proposing is in your best interest. If you do have those kinds of questions, I definitely recommend getting some legal advice. You can get legal advice for free here in Milwaukee County through the Marquette Volunteer Legal Clinics. For those of you who aren't located in Milwaukee County, you can contact your clerk of court to find out what resources are available in your area. All right, so the medical and healthcare expenses. So this giant paragraph here is just explaining some of the various rules related to coverage of kids under health insurance. So you should read through that if you have questions about it. Very helpful, I think, to get some legal advice. But the basic gist is it's saying if health insurance is available at a reasonable cost, then parents are expected to provide health insurance for their kids. So here we're going to go through how that health insurance will be provided. So you can either say both people have private insurers and both people will have the kid on their kid or kids on their private insurance, and since they're both going to have the child covered, nobody needs to make a cash contribution. B is saying one parent or the other will provide private health insurance. So here, if the kids are going to be on Jane's insurance, we would put Jane Doe here. If the kids are going to be on John's insurance, we would put John Smith here. And so then we'll say that person shall provide health insurance. It wants to know on this line the out-of-pocket cost. So the difference between a single-payer plan and a family plan. So if at John's job, a single-payer plan has a $100 premium, but a family plan has a $250 premium, it would want that $150 listed here. Now, if you are like many people, you don't know what the difference between a single and a family plan is because you've always been in the family plan. There are a couple of different ways to approach that. Probably the most proper, the thing you are supposed to do, is you can contact either your insurance provider or your HR department and find out what the cost would be for a single payer plan, and then you can calculate the difference between a single payer plan and a family plan. If that isn't an option for some reason, or if you contact your insurance provider and they're not able to give you that information, then our next best recommendation is to go ahead and just put what your actual insurance premium is. So John is paying, remember, $250 for the insurance premium every month. Do note that just because you wrote $200 here, you can't, the out-of-pocket cost that the court will consider when determining the reasonable cash contribution from the other parent is still going to be the difference between a single payer and a family plan. Particularly for those of you who are agreeing, so if you're doing this as part of the marital settlement agreement, this is less important, and more important is what number you guys are agreeing to for a cash contribution. For those of you who are doing a proposal, if you're proposing that the other parent make a contribution, just know that it's going to be based off the difference between single payer and family coverage. So you will probably want to get that information. So we'll fill this out properly with John. We'll do the $150 there. Great. Here, this is what you're suggesting the other parent pay towards having the kids on the health insurance. So here, John pays the difference between a single payer plan and a family plan. He pays $150 to have his kids on his health insurance. So in this proposal, you can, if you want, Jane is filling this out. So Jane could say, I'm going to contribute $75, half of the cost towards the cost for health insurance. They could do that there. For some folks, you would include, if you're doing that, it can be included in the child support section, which we're going to get to. If you and your spouse are agreeing that you don't want there to be a contribution, you can put 0 there. Or if you are doing this on your own, but you just want to propose that there not be money, contribution towards the health insurance, you can propose that as well. So that's filling out that section. The next section, section C, is if you receive state insurance. So this is basically saying neither of us gets a private health insurance policy that's available at that reasonable cost under the definition the state has up in this giant paragraph here. So we have state insurance. So C, you check C, you indicate who has enrolled the kids in the public health insurance. So in that state insurance, in Badger Care or whatever program you've used. So here, if this were the case, maybe we'd say Jane you either say if you have already enrolled the kids in, so they already get Badger Care, you would check has enrolled in. If you haven't enrolled them yet, then it would be shall promptly apply for. So we'll say Jane has already enrolled them in. And then down here, you'll indicate if there's any out-of-pocket costs for the public health insurance. For most people who are coming through our clinics, we find that there is no out-of-pocket cost. So if you don't have a monthly premium, so I know people will come in and they'll say, well, I have copays. We're not talking about copays here. Here we're talking about the premium. So if there isn't a premium, you'll check number 1. If there is a premium for that public health insurance, you'll check number 2. And then just like above, you're going to indicate what the cost is to have the kids on that insurance. Maybe it's $50. And then how much, if any, you're proposing that the other parent pay towards that amount. So it could be 0 or it could be half of it, whatever it is you'd like to put there. Last but not least is D. So D is saying that there is not free public health insurance available, and both people's income is below 150% of the federal poverty level. And so they can't make a cash contribution towards the health insurance. There isn't private health insurance right now. So it's saying basically we don't have insurance, or I don't have insurance, and we don't have private insurance available, don't qualify for the state insurance, all that kind of stuff. So we'll go back up here and we will say that both John and Jane have private health insurance available for our situation. And the last little bit of this section, you have uninsured healthcare expenses. So this is those, anything not covered by insurance, those copays, dental, if dental's not covered, if you have out-of-network costs, or if you have orthodontics, or if there are some hospital fees that aren't covered by your insurance. Whatever it may be, anything that isn't covered by insurance goes here. The form presumes that you guys are going to split it 50-50. So if you want to split uninsured healthcare costs 50-50, great. Move on. You don't have to put anything here. If you want to split it some other way, so let's say they plan to have Jane pay $75 and John pay $25. You will check the other boxes over here, and you'll write in the percent that you want to do for each one. If you want it to be 50-50, again, you just leave these blank and don't put anything in. So we'll say John and Jane have been pretty 50-50 so far, so we'll continue to have them be 50-50. And then reimbursements. So basically, John and Jane in this situation are going to split the uninsured healthcare costs 50-50. If a healthcare cost comes up while the kids are with Jane, she can send John a notice in writing. So she sends him a little note saying, hey, here's what I paid, here's the receipt, please pay your half. What it wants to know here is how long does John have after he receives that written that written notice that there was a healthcare cost? How long does he have to pay? So you can put in any number of days you want, 20 days, 50 days, 100 days, 30 days, whatever. I'm going to put 30 days because I think that's the most common one we see. But again, you can put in any number you'd like. And some people ask about this line here. I don't know why it's there because you can put any number of days you want there. So I don't know why you would need an other days box. But somebody put it there. If you understand what it's for, great. I'll admit that I've been doing the forms for years and I don't know why it's there. So we ignore that one. All right, well, that is all for the health insurance section. I will be back later with more on the forms here. We'll do the child support section and some other ones. So until then, I hope that this video was helpful. Thank you for watching it. If you do need additional information, we are available in non-pandemic times in room G9 of the Milwaukee County Courthouse, where we can give you legal resource information and also answer any questions that you have about the forms. Until then, thank you all again for watching. I hope that it was helpful. And until next time, I hope that you all go out and represent yourselves well.